And just so everybody also knows and remembers, there's a, for the webinar, it was also extended to participants beyond the LAC platform. So we should have people joining from other regions as well.
Hello, good morning in America, good afternoon in Europe. I am Diego Morabello, consultant of the LAB platform. For me, it's a pleasure to be with you today in the webinar Guidance Now Global Fund Sustainability, Transition and Co-Financing. This document is intended to support countries to strengthen sustainability, increase domestic financing, and enhance preparation for transition for global fund supports as they develop fund requests, implement global fund grants, and manage national HIV, TB, and malaria programs. Today, we have a great program with super special guests. First, we will have the words welcomed by Julia Perron. Julia is LAC Regional Manager for Global Fund. Then we have the introduction by Matthew McGregor, Sustainability Transition and Co-Financer Manager. We will delve into the importance of this issue in the response to HIV with Maria Veronica Espinosa, Public Health Monitoring and Evaluation Specialist, and TB with Jamil Cabrera Silva, Public Health Monitoring and Evaluation Specialist. We will talk about Health Management Information System and Monitoring and Evaluation by Paul Bonilla, Sustainability and Transition Specialist. Continue with Health Products Management, Bhushan Shestra, Health Products Management Manager. And for the end, with Social Contracting, Carmen Gonzalez, Fund Portfolio Manager from the Global Fund. I want to remind our panelists to be careful with the time. Each one will have around 6-7 minutes for the presentation. Without further ado, I would like to welcome Julia. It's a pleasure to see you again. Julia.
Thank you. Good morning to everybody on the other side of the ocean, and good afternoon to my colleagues in Geneva. I'm Julia Perrone. For those of you who don't know me, I am the regional manager for the Latin America and Caribbean team in the Global Fund. I took over from Annelies Hirschman in July, so I'm fairly new to the role, but not new to the Global Fund or the team. I've been around at the Global Fund for now almost 11 years, and I've been FPM in a variety of countries in LAC and in other regions. So I trust I know some of you that are attending to this call. One thing that I would like to ask, as we don't have time to do a round of introduction, is if you can write in the comment box your name and which organization and country you represent, so that we know, and it's going to help us in the discussion that we hope to have after the presentation. So before giving the word to my colleagues that will introduce you to the Sustainability Transition and Co-Financing Policy, I wanted to just give you a few introductory remarks and on why we are having this series of webinars. And we know that this is a difficult time. It's been a crazy year for you guys and for us here in Switzerland. We have seen difficulties, we have seen struggles, but we have also seen many good practices, and we first of all want to thank all the countries and all the people involved in the response to the 3 diseases. You know that you have been working very hard in very difficult circumstances with the COVID to keep on going and to adapting and to innovating to be able to provide services in this new world. So thank you, first of all. I think this presentation will show you the standard, let's say, policy of the Global Fund in terms of sustainability, transition, and co-financing, which is very relevant for the region. While we know that this is an exceptional time, and we know that COVID poses different challenges and uncertainties to the way we work, and the sustainability transition and co-financing area is not an exception to that. We know that the economies in the region are very affected, and that creates uncertainties on the economic growth and overall environment, but also on the fiscal space and the capacity of government to maintain national resources and increase national resources for the three diseases. We know that the three diseases have been impacted. We don't know by how much, but we know that there is a risk to go back in terms and lose the progress that we have made in the past few years. And for sure, we have seen every day that the way we respond to the three diseases, many of the standard activities and interventions, they have been difficult to continue in the COVID context with lockdowns and restricted mobility. So we know that we must adapt and find innovative ways to carry out activities and continue to work in a very uncertain situation. I think these four elements are all somehow linked to the sustainability and transition and co-financing policy of the Global Fund. And I think that the way we have designed this and the board approved this policy give us space to make sure that this policy remains central to the mandate of the Global Fund in the region, and that we apply it considering this challenging. So just to make a few examples, I think it's important that when we continue to work on sustainability plans, we consider how we will make our health system more resilient in the future. And when I think we do need to continue to work on analysis and to develop tools so that we can understand better what's the fiscal reality, what's the fiscal space, and we continue to do advocacy to ensure that national spending on the three diseases is maintained and increased. And of course, we need to continue to look at how all this situation is affecting the abilities of countries that are projected to transition relatively soon, so that we can plan ahead and ensure a successful transition. So all in all, I think that the policy remains key and remains relevant. It tries to address questions that are relevant to the current environment. I know that many of us are concerned about the question of eligibility and what do we do in countries that are supposed to transition. I think the good news is that very few countries or components are going to transition now, because we have seen that we continue to have most of the countries eligible in the next cycle. So there's time to look at that, and I think that only focusing on that is somewhat reductive. And I hope that during this session, you will see that when we talk about the sustainability co-financing and transition policy, there's so much more that we need to discuss, and that is very relevant, that it goes well beyond eligibility, and that it are things that are very, very important in the current COVID context. So when we talk, for example, about efficiency in spending, and that's something that in a context of scarce resources and crisis becomes even more important, as is the emphasis that the policy gives on strengthening health systems and ensuring equity in the provision of services. Of course, there's a lot about sustainability and a lot about the need for countries to continue financing the diseases, which I think is something that we all agree on, independently on the COVID crisis. So I think that's all for me. I again want to thank everybody for your participation. I hope we'll have enough space to have a rich discussion at the end, and I will leave you in the competent hands of my colleagues, starting with Matt for an overview of the policy. Thank you, everybody.
Thanks, Julia. Diego, I'm assuming I can dive right in. I hope that's okay. Thanks, Julia, for the introduction, and hello to everyone. My name is Matt McGregor, and I'm the Senior Manager for Sustainability Transition and Co-Financing at the Global Fund, which means I help to oversee the implementation of the policy. I'm also a former fund portfolio manager in the LAC region, so know the region relatively well, although it's been a while. And I'll be very brief. I just want to kind of contextualize the discussion that my colleagues will have on the more technical aspects of the context note, of the guidance note. Go ahead, Diego, to the next slide. But I think that when we step way back, Diego, you can go to the next slide. Really what the SDC policy is all about is how do we work closely with countries, civil society, technical partners to strengthen the sustainability of our investments, raise additional domestic financing and strengthen efficiency of existing financing, and work with countries to enhance transition preparedness. It's really our commitment to working in whatever context, including the current, to make sure that we're continuing to strengthen the sustainability of these programs. This has always been a part of the Global Fund's work, but it took on increased prominence during the 2017-2019 policy allocation cycle when the Global Fund's board passed the SDC policy and we implemented it for the first time. And I think there's been a significantly enhanced focus on these themes in all of the work that we do, whether it's the enhanced transition planning that we're doing with countries and national stakeholders, whether it's addressing specific transition challenges in grants, co-financing commitments, strengthening health systems, as Julia talked about. So there has been enhanced focus on these themes, but we also know that this is an ongoing and evolving issue, an ongoing agenda. And so it's really important that we continue to learn from the experiences we're having and see how we use those to strengthen our work moving forward. And that, in many ways, is what we're going to talk about today. When we put together the guidance note for this cycle, we really tried to build upon those lessons learned so that we can continue to improve our work moving forward. Next slide, Diego. This is particularly important for the LAC region because, as many of you know on this call, many of the countries that are in LAC are countries where we're really emphasizing the need to prepare for transition. As Julia said, not because there are that many countries transitioning, but we know that this efforts to address transition challenges takes time. And working on these as early as we possibly can is key to success. Next slide, Diego. So as I mentioned, when we, go ahead, next slide, Diego. When we put together the guidance note, it was really a reflection of many lessons learned across many thematic areas, whether it's co-financing, transition and sustainability planning, grant design. And while I won't go into all of these on these slides, it's a helpful reference because these were the joint recommendations that we developed after the first round of implementation of the SDC policy and highlight themes that I think you'll see are more clearly focused on in the guidance note that my colleagues will present. Next slide. So what does this guidance note really focus on? Well, it provides the background and context to our work on STC, the why of our efforts on STC. It defines what we mean by sustainability and transition. It offers some kind of core sustainability considerations that we think all countries, all national stakeholders, and the Global Fund should be thinking about when it comes to strengthening sustainability. It offers additional transition considerations that we think need to be increasingly a focus in places that are closer to transitioning. And then it also outlines the requirements the Global Fund has put in place, whether it's on co-financing, application focus requirements, transition assessments, transition planning that the policy provides. But I think the key thing and where we'll focus on this webinar is what's one of the new things in the guidance note is really the additional annexes that look at sustainability from either a disease-specific lens or a specific thematic area, whether it's HIV, TB, and malaria, whether it's health product management, whether it's health management information systems, social contracting, transition planning. And we added these annexes in many ways as a response to the ongoing learning and the need to really take a more nuanced approach to thinking about these issues as we try to strengthen sustainability. Next slide, Diego. So I'll just finish by saying, we really believe that this is a key addition to the guidance and hopefully will help support you as you have discussions at the country level around these really difficult themes. Clearly, the way in which they manifest themselves are not going to be the same. Even in a regional level, countries are very different. So this is not meant to be a prescriptive overview of everything a country will need to do, but we hope that these annexes really help provide a more nuanced, a more constructive, a more robust conversation about how we continue to work to strengthen sustainability across the LAC region. So with that, I'll stop. I look forward to the conversation and the question and the answer, and I'm going to turn it over to my colleagues to go from there.
Thank you, Matthew. Remember that at the end of the session, we will have a space to ask questions and comments. We continue with Maria Veronica. Hello, Maria.
Thank you very much. Good morning to everyone and good afternoon to those of you who are here in Switzerland. As it was mentioned, there are some specific annexes. The annexes include HIV, TB, and malaria, specific disease annexes, health product management, health information systems, monitoring and evaluation, public financing, and CSOs. I'm sorry, I'm gonna start the camera so you can all see me. I'm so sorry. There, can you see me? Hello. Okay, so what is important about these annexes? I will start mentioning the purpose and some of the caveats that these annexes have. So the idea is to provide an overview of the types of challenges for specific diseases and specific technical areas which programs may face during the strengthening of sustainability. So why this is important? Because we need to respond to the reduction in global fund allocations or transitioning from global fund financing. And this is trying to offer some considerations to address those challenges. It also tries to foster an even more articulate conversation about sustainability-related challenges based heavily in the different country contexts. And I think this is important, as Matthew mentioned. The challenges and recommendations are very heterogeneous across the global fund portfolios. It's not exactly the same. The context is different for every country. So we will see a strong difference between countries and regions. So the challenges and recommendations that are mentioned in these annexes are illustrative, and they might not be relevant for every context, but we need to discuss for the reality of each country how this is important or how it can be applied. So next, please. Yes, so the document, and the one before, please. We just passed ahead too much. Can we go to the leadership and governance, the previous? Thank you. So the annex actually has divided for the HIV specific annex in 6 different areas, which are leadership and governance, program implementation and service delivery, health systems and HIV, human rights and equity, and financing. And for each one of these subjects, it starts by identifying some of the main challenges. I will not go into all of them because we don't have enough time for that, but I will be happy to address them during the questions. But some of these challenges might be very interesting to discuss or to identify if they are actually accurate for your specific context. And for example, I will mention the importance of maintaining and coordinating multi-sectoral partnership and how this is effective and a very transcendent step for sustainability. And then the document presents some consideration which are stated here in the slide that you are seeing. So for leadership and governance, you have them all there, but I will probably pay attention to the necessity to embed civil society in leadership and governance structures. And we are not just referring to the importance of having civil society opinion or being consulted, but actually being part of the leadership and governance structures in an institutionalized way in order to have not only their point of view, but also their involvement and commitment in all the related activities regarding to governance and leadership. So there's much more explanation about this point in the document. I will encourage you to read it. For program and implementation and service delivery, there are also some challenges that are identified in the document. I will mention, for example, how key and vulnerable populations are often not reached through general health services. This is something that we are well aware of, and we haven't seen it in most of the contexts. But we know that the general health services are not designed specifically to address specific needs. We have discussed, for example, how the opening times of health services are often not adequate for our key populations. And this has a very strong impact in the capacity to access the services for key populations. So there are some considerations that are being discussed in the document. which include the streamlined program activities and enhanced value for money, how important it is to enhance value for money to inform program implementation and decision-making, enhance human resources capacity and planning, including ways to retain community health workers. We are seeing the importance of community health workers, but if there is no encouragement, if there are no incentives for community health workers, then we might face a bigger problem in the future, specifically for transitioning. The development of plans to maintain community engagement in the HIV response, particularly for activities managed by non-government partners or donor-funded. How are we going to do to maintain this community engagement once we don't have donors that are funding mostly of these activities? How we are going to sustain the community engagement after the transitioning process. Please, next. So for health systems and HIV, we are very aware that challenges are still very big regarding health systems and information in HIV. We do not use the information, we do not collect information that we are not going to use. So if information is not required for decision making, then probably information is not going to be collected and is not going to be registered because it's not needed. We need to develop the capacity of the countries to really use information as an asset for decision making, and this is not necessarily happening. And this affects directly key populations because most of the information that is used comes from general population and not key populations. And in many cases, as in many contexts, that information is not even being collected. So how can we expect decision making to be focusing on key populations when information is not even being used? So some of the considerations that are included are the strengthening of national standardized data collection tools and processes, the update of procurement policies. This is related to the need to strengthen our capacity to stop stockouts and have, we go back again to value for money, procurement through the adding of necessities from different countries, for example, and some other mechanisms that can allow us to have medicines and supplies at lower prices. The strengthening of HIV lab services, this is a very important element, and multi-disease diagnostic platforms are related to that. I will go really fast because I don't have much time left, but we have also considerations on human rights and equity, and for financing, you have them all there, and they are all very specific for all the different issues that are considered in the document. And I think you will relate many of the challenges that are stated in the document. And of course, some of the consideration might encourage us to discuss how these elements might be implemented for a specific context. Next, please. So finally, I will probably just stay a little longer in the conclusions, and I think this adds up pretty well on the aim of the document. So to strengthen sustainability of the HIV response, some of the key considerations include to increase multi-sector political will, engage communities affected by HIV in decision-making process, not just asking them to participate lightly, but really being engaged in the decision-making process, and leverage health sector reforms, including universal health coverage. Ensure capacity to identify new infections, establish real-time feedback loops in quality of service, link program effectiveness with efficiency, integrate HIV systems and strengthen the health system procurement, laboratory and information system, address barrier to access to service and reduce stigma and discrimination, and finally, secure domestic financing for interventions for key and vulnerable populations and treatment scale up. So I believe this makes a very short preview of what is included in the document, but of course the annex has a lot has much more information for you to discuss over. And I will insist, I will encourage you to read it, to read it, to go through it. And of course, we are open to any question you may have. Thank you.
Thank you, Maria Veronica. We will talk about TB with Jamil Cabrera Silva. Jamil.
Hello, good morning and good afternoon to everyone. Yes, as Matthew and Veronica were saying, the next one, please. It is important to understand that what we have here in these annexes and in the PowerPoint are a series of things that are not always that you will find in every country. It's not that you will find this in your country specifically, all of this, but just some of them. The idea of this webinar and presentation is, I understand a little bit more of picking up your curiosity about this and taking up the document and reading, because time is very limited to go into the detail of each of these things. So it's important for you to understand that in the document itself, you could find, for this tuberculosis annex, for example, you will find a list of challenges and key challenges that were identified by the people working in the Global Fund that are important to address if you are trying to do these sustainability interventions and planning for sustainability. And these challenges, key challenges, are organized in key areas. For the case of tuberculosis, are very similar to the HIV ones that were presented by Maria Veronica. I include this governance and leadership, policy environment, domestic financing and co-financing, procurement, and service delivery. So inside of these key areas, you will find these key challenges that are things that you could find in your country, that are problems that you could identify yourself, that maybe you are seeing these things. For example, for governance and leadership, one of the key challenges that is there that you could find is that maybe TB is under a very small part of the Ministry of Health that is not much, it has not much importance, is a problem that is a minor problem if you compare it with, I don't know, mortality among mothers or infants, and this could be a problem in order to then gain more support from the authorities, no? So you will find a series of challenges, and then considerations that you could take into account in order to plan for a good response on how to address these challenges. So here in the slides, we see for each of the key areas. For example, we have early planning for financial sustainability. This is very important, and this is not exclusively for tuberculosis. If you are trying to address this, and you will do it for any other disease, it's just not tuberculosis specific. But in the document, you will find examples more related to tuberculosis. Next one, please. Is the same thing for this is another areas, procurement and regulatory environment, and you could find here same thing again, that there are some ideas and considerations that you could take into consideration to address this. And for this specific slide that is related to procurement, you will find we will have in the next slide some presentation for HPM people that is touching more on these topics. The next one, please. For the key areas, I think this is the most important one that is more related with tuberculosis. And you could see, for example, the first one, when you are planning about sustainability in TB, you should consider modifying TB care model from inpatient to greater outpatient services. This is very, very key and very specific for tuberculosis. All the other ones could be adapted to any program, but in the case of TB, this is very important. If in your country, for example, you are having the TB care is an inpatient TB care, and every patient that is treated for TB need to be hospitalized. It could be for the whole treatment or just part of the treatment, but hospitalization is part of the thing. This is not good for sustainability. You need to move away from this model and to have outpatient services or community-based services, and this is something that you should have in mind in order to improve your response and the sustainability of it. And if you see, every one of these considerations are related with value for money, it's related to efficiency and how to do the best answer for your epidemic with the least resources. Basically, this is the spirit of the whole thing. The next one. So as I was saying before, all this detail, you could see it in the document, but I think this is the very important slide for this tuberculosis annex. Here you have the summary, the real, the core message about this. So we will see every line here. So to strengthen sustainability of a country TB program, key considerations include early planning. This is very important. You couldn't do the sustainability transitions from one day to the other. You need to do it with enough time. Matthew told us at the beginning, not all countries in Latin America are already in transition. Most will come later, but the idea is to start thinking about it now and to start planning about it from now. A supportive policy environment. If you don't have this support of the authorities from the main decision makers, it will be very difficult to do or to find national resources or any other support to do the transition. So you need to start working now to get this environment that is supportive for your goal. Sufficient domestic finances, this is very clear. If you don't have enough money and you are now depending on external resources, the day that these external resources are not there, and if you don't have domestic money to cover this, everything will fall apart. So you need to think that the key and the objective of have this supportive environment and having this early planning is to get this domestic money. Streamlined procurement and regulatory environment for procurement TB drugs and diagnostics. Yeah, we will see this later on here, but basically is instead of buying just you, or in some cases, you as a country, you could buy pool it with other countries in an international pool mechanism. But we could see in our region even that some countries, they procure drugs and procure supplies at subnational level, which is more costly and is not efficient. And finally, a supportive service delivery model, which includes attention to TB-specific key populations, human resources and information system. Is a little bit what I was saying before. This is important, that you have a very clear and cost-efficient service delivery model, because if it's not cost efficient, then having this being sustained by domestic resources won't be easy, because it will be more expensive. So you need to try to find a way that these services are very cost efficient. So given the scope of such changes, countries should establish a timeline for introducing the necessary reforms gradually, but with a specific mutually agreed upon milestones and accountability mechanisms, while the Global Fund and other donors' support is still available. It's a little bit the same message of the beginning. If you don't plan early and you don't have a clear route on how to do this, you won't do it. You won't be successful in this. So the idea is to plan early, and this plan should be very clear, with a clear route, with milestones, with clear objectives of what you want to do and what you need to change to achieve these 5 points that we see before. And the idea is to do this while Global Fund money or external money is there, because the day that is not there, it will be more difficult. So I guess this is for the TB part. Yeah.
Thank you so much, Jamil. Now, Paul will be talking about the importance of monitoring and evaluation systems. Welcome, Paul.
Hi, everyone. Good afternoon, and thanks for joining us. And thanks to Maria Veronica and Yamin, Julia, and Matt for their comments before. Another area where they've developed a specific annex and where we've seen a lot of discussions in country about the importance of strengthening the health information systems and the monitoring and evaluation capabilities on the ground. It comes up a lot because of the importance of having strategic information to be able to guide the responses moving forward, especially as there have been many investments from donors into these systems, and there's also often concerns about making sure that the human resources and other key components of those systems maintain their strength and continue to be available. And so these are general in this initial slide is kind of the areas where investments are recommended. And I think especially this last one of considering the challenges and mitigation actions to make sure that national M&E systems are integrating the activities that Global Fund has been supporting and other partners, and then also trying to make sure as much as possible that resources are mobilized to support the national M&E and HMIS systems. We can go to the next slide. And so we have two slides that kind of outline a group of challenges and some considerations that are highlighted in the annex that can help guide country discussions when thinking about how to respond to these challenges, either when preparing a sustainability or transition work plan, or preparing activities for a new funding request or during a grant making. And so one of them is the importance of policy, legislation, and governance. And this often comes, sometimes countries, the health information systems that grants are using have been pushed with donor resources. And so there's necessarily a lot of, there's maybe enough local ownership of the systems, or there might need to be political support to help further integrate these systems into national systems. And so this is the type of work that there's various sets of TA available for, and with the idea of continuing to strengthen in-country coordination and collaboration on HMIS. And some examples that we have on this are in Costa Rica, where they are working on, with support from PAHO, to support the integration, let the Ministry of Health have a better national surveillance system in integrating not only the programmatic activities that have been coming through Global Fund supported programs, but also integrating that with their large national health information system. Financing of HMIS and M&E is something that there is always significant investments from the Global Fund on, but that in order to maintain these, a lot of those supervision visits, a lot of those monitoring visits are often financed through grants. And these are things that that countries need to make sure are slowly absorbed, and that they're being coordinated in the most efficient way possible so that stakeholders can continue to strengthen the systems and get this information, and that countries see the value in doing that. Also, program reviews and evaluations. There's, depending on the context, there's varying levels of national capacity for carrying out quality program reviews. And so not on the last years of a grant, but as grants are being implemented and the country continues to absorb more and more activities, it's really important to engage and build the national capacities to do different reviews and evaluations or surveys, and so that capacity stays in country. And this is a really important component to consider. We can go to the next slide, please. And then these two last areas, the routine reporting and HMIS system, ensuring requests include activities to build national sustainable HMIS and M&E systems that engage both private sector and communities and the various stakeholders, and not just the national health system, because we know how important it is to have full visibility on the different parts of the response, especially depending on the disease. And furthermore, data analysis and use. And I think this is where we've seen a lot of really interesting activities come out in the LAC region, and trying to push not only just having a system, but using the data that's coming out of that system, using it to make programmatic and strategic decisions, making it available to civil society actors so that they have a better understanding of what's going on, so they can also use it as an advocacy tool to mobilize resources and to ensure that the HIV, TB, or malaria responses are not left behind, and that and so this is a really not only doing the analysis, but also disseminating the analyses and being able to use them to make recommendations is something that we've seen as a really critical activity, and that a strong M&E and health information system is critical for. We'll have time for questions a bit later. Before we move on to to our colleague Bhushan on the Health Product Management Annex, I will also say that there is a malaria-specific annex. However, we haven't gone through that on here because of the audience that's usually joining from the LAC regions, very focused on HIV and TB. But that's also a document that's available on the Global Fund's website. And with that, I'll pass it on to Bhushan.
Thank you, Paul. Now, Bhushan will help to us understand how the basic components of medical device management support sustainability.
Next slide, please, Diego. Thank you. So good morning and good afternoon, everyone who joined the webinar. It's good to talk to you. So I'll, like my previous colleagues have mentioned, I'll focus on the health product management of health products, which previous colleagues have also touched on different aspects of that HPM management. I'll focus a bit more on these 5 areas that you see on the presentation, but there's also additional important point, which is on the diagnostics and lab services, which is also part of the annex of the STC guidance note. So I urge you to read the 6 pages of the Annex 5, which is on health product management and sustainability. And it is a critical area, which of course cuts across all the diseases and even goes beyond HIV, TB, malaria, and is critical in all the countries. So the areas, the annex is divided into possible challenges, but also offers useful considerations and tools that you could consider when planning for transition and sustainable focused interventions in your country. And like I said, these 5 areas are clearly mentioned in that. In addition to, there's a section on diagnostics as well. Next slide, please. So talking about policy, legislation, and regulations, I won't read through the whole slide, but obviously we have to be cognizant of the challenges that we have in the countries on different areas of policy, legislation, and regulations linked to health products. In addition, I would also add that even the procurement and financial policies and regulations need to be considered in when managing health products, as at times they also can be a barrier at times. And on that area, we can look at mapping and analyzing access and to issues and agreeing to country-led response to address these challenges. We can also you should also prepare to introduce flexibility in national legislations, especially in procurement, where we have seen a lot of challenges in quite a few countries. There are obviously at times flexibilities as well, which can be, when justified, can be approved by the management or even higher level when it needs to go up in the ministry. Of course, the legislation need to be cognizant of WHO recommended optimal products by disease programs. And as you know, nowadays there are new products, new treatment products, new diagnostic products. So again, the treatment guidelines on that need to be updated regularly, and the countries need to adapt to the new regulations as well. We also encourage the countries to strongly look at investing in strengthening national regulatory authorities, NRA, national regulatory authority capacity. And actually, we have even published a separate technical brief, which is on our website. You can have a look at that for more technical guidance on this front. And again, I stress that since we have new treatment, new drugs being introduced, new diagnostic products in the market being approved by the Global Fund and WHO, you should look into more technical guidance on this front as well. Linked to that, selection and rational use of the health products, be it treatment products, pharmaceuticals, or diagnostic products, that needs to, of course, be in alignment with WHO guidelines and, of course, national treatment and diagnostic guidelines as well. So it will be good when you plan for transitions to have, for example, systematic annual review systems or for a longer period where you can account for new WHO guidelines coming out and then adapt the national treatment guidelines as well. Of course, the focus should be on adopting and procuring new optimal regimens and fixed dose combinations, for example, for ARVs, and even for other areas, we have new formulations which come out in fixed dose combinations. We also would like you to consider and advocate for stronger government committees or a working group, which can be tasked with reviewing and updating the guidelines. Again, these are multi-stakeholder technical working groups or committees, which should be taking into account the new developments in the global development, WHO guidelines coming out, and seeing adapting them to the country context. All these, of course, need a lot of internal domestic financing, resourcing support, but also we would like to support where possible in extending the transition planning in working with the country stakeholders. Next one, please. So as most of us probably have heard, is in the transition planning, the procurement and sourcing of health product comes up as one of the most critical and challenging matters when we transition from global fund to country procurements. And this area needs serious consideration from day one. So if you have a transitioning grant or you are going to transition to full domestic financing and of course procurement down the line, we strongly urge you to discuss and look at options. In LAC region, you have a good option of using the PAHO strategic fund as well. You might have heard of Global Fund opening up our full procurement mechanism, the WOMBO system, wherein countries could volunteer to use the system as well. So we have opened up new opportunities, and again, we encourage you to look into different options you have in the country, but also engage with us and some other international procurement entities which could offer you solutions in the medium term or even for a longer term if the country decides to do that. Again, the procurement requirements and specifications have to be non-restrictive so that the local bidders and others do not take undue advantage of the national limitations. We also encourage you to use all the available international knowledge and intelligence to inform on the procurement pricing. So for example, the pool procurement mechanism, WOMBO system we manage, we publish our international reference prices regularly on our website, which can be a good reference for the national procurement entities or the national programs planning to budget for and procure the health products in the future. Of course, as you know, the strategic fund publishes the international the reference prices. Global Drug Facility also publishes reference prices for the TB products they supply. So all this can be taken into account for your proactive planning for the budgeting, but also procurement of the health products. For supply chain, again, we have some guidance here, but we have also published the in-country supply chain technical brief, and please again look into options mentioned in those documents, plus this STC guidance, which has useful guidance on how investing in strengthening and optimizing health product supply chains in country, plus some upstream considerations need to be accounted for your transition planning. Some services could be outsourced to NGOs as well, but obviously all of these will require the implementers to have strong management skills. They could be either the public sector or the private sector. There should be sound performance management systems. You could have performance monitoring KPIs built into the contracts with either your vendors or your service providers like the NGOs. And you should have country level planning for integration along the different disease programs as well. So as you know, we have tried to encourage as much as possible the integration of HIV/TB programs, and same could be applied to other disease programs as well, and would want to urge you to use the integration opportunities once they come up. We could also look at stopgap measures, like for example, rapid supply systems. We also have that under our PPM system. I'm sure PAHO Strategic Fund can also help in that area at times. But we should plan not to have emergencies, and that's the proactive management planning for supply chain. And of course, all these are based on a sound organization and management of different processes that you need to ensure that the health products are quantified, are procured, are supplied to the country, are warehoused and distributed, and are rationally used in your different disease programs. So all that requires obviously a robust and qualified health workforce. And again, we urge you to look into these possible tools and interventions that could be used to strengthen these areas in the country as well. Next slide, please. So having said that, as my previous colleagues have also said, that all these bullets cut across the different diseases. They are provided in the TB annex as well, and in HIV annex well, and some are in the malaria annex as well. So they probably would apply to all the disease programs. So basically, the critical thing is to adequately ensure that the financing for health products are there to meet the needs and targets of the national strategic plan, so they are well funded. An alignment of the timing and distribution of that financing aligns with the procurement cycle. At times, we've also seen that although there's domestic financing, delays in procurement, tendering issues have led to the budget not being used up in that year. Again, all the financing, procurement, and tendering aspects all need to be well aligned. We would again encourage early, proactive, and robust country-owned planning mechanism in place, and also to be governed by the capable technical working groups or committees that are mandated to do so in advance of reductions in external financing like Global Fund. Access to quality assured health products through policy, legislation, and regulation changes need to be planned in advance. So if there are going to be challenges with that, which are time consuming, you need to plan in a couple of years in advance so that you arrive at having regulation or flexibility which will ensure you can buy the products that you need for the disease programs. Use of optimal products to maximize disease impact and minimize chances of development resistance to medicines. This is key, especially for HIV and TB programs, also for malaria, wherein we have seen some form of resistance in some disease areas, and there are new drugs which offer the best treatment to patients. And again, these are introduced by WHO, approved by WHO, and we encourage the countries to look into these new treatment options as well. The procurement, national procurement systems need to be strong, and sourcing and regulation policies need to be innovated to adhere to the country's challenges at times, including for procurement and supply planning. And to manage all this, like I said in the last slide, there needs to be efficient management systems in place, including for human resource and financial management, which needs to manage all these areas. And there's a section, like I said, separate for diagnostics and laboratory services and products, which are critically important, like for treatment products. And these tools and considerations are also highlighted in the STC guidance note. Over. Thank you.
Thank you, Wisham, for this great presentation. Finally, I want to say welcome, Carmen Gonzalez. Carmen, it's a great pleasure to see you with us again.
Hello, everyone. I hope you can hear me well. I'd like to deep dive into the issue of public financing of CSOs for service delivery, normally known by many people as social contracting. So before we go into some of the details, I just would like to go briefly over the basics on what is the definition of, or how Global Fund and as well as other organizations are understanding what social contracting means. And we are using a very general definition of an agreement in which a government agrees to pay a non-state actor for service rendered, and a non-state actors agree to provide certain services as an exchange. So in some cases, this may mean a grant. In some cases, this may mean a contract under the national procurement law. both cases, we are considered as social contracting, and we will go later into further details that will help you to understand the nuances of that. Then, as a background and context, I would like also to clarify that very often we are bringing this discussion on social contracting related to transition preparedness and how to replace donor funding, in this case global fund funding, with domestic resources. This is an important part of the discussion, but social contracting is not only about that. It's an instrument, it's a way to facilitate that countries are meeting the international and national health goals to ensure sustainable access to services for key and vulnerable populations. So how we can guarantee that key and vulnerable populations are getting all the services that they need with quality and sufficient scale. So this is very, this is what I would like to highlight here. It's not just replacing some funding, it's about complementing funding to ensure that key and vulnerable populations are getting the services that they need. And normally, what is recommended is that countries choose a mixed strategy between putting funds in formal health facilities that go down to the community level to be able to reach these groups. Also working with community health workers to reach further and to reach certain groups. But in addition to that, working with community civil society organizations who are able to provide those services to a specific group of people. So this is the basics, and I think it's important to remember because sometimes we may get to focus on the element of replacing donor funding. Next slide, please. So why a country decides to use social contracting as a strategy to fund and deliver services in a specific country? There are many reasons why a government may decide that, but there is, we've tried to identify the most common ones. One is that a government decides to have as core function the stewardship of the responses, making policies, setting up standards, etc. But the delivery is provided, is given to other actors. Some cases is because of limited government capacity, and I think the COVID context has given us many examples about why a moment where the government sees their own capacity restricted and that they need to trust and they want to trust civil society organizations to be able to reach beyond what they are able to reach. And other governments start by the recognition that the CSOs or non-state actors have a specific added value. They have added value to bring to the health sector responses, and that there is a specific role that they can play. So these are more or less the main reasons. Next slide. So in the last years, we've worked with different countries, and we have supported different countries in working on this issue. In some countries, in many of the countries, we have started by doing a preliminary analysis of what is the situation. So different actors that are involved in this discussion can understand better what is the legal framework, what is already available, how different CSOs can be funded or cannot be funded under the current legal agreement. In some countries, you have the possibility of funding CSOs, but you don't have the possibility of funding CSOs who are managed or led by key populations. So we have to understand the situation in order to be able to tailor the strategy adequately. Next slide. then it's important to get to understand the basic principles of social contracting. And we have tried to capture those here to kind of highlight certain elements that we believe are important to keep in the core of this discussion. One, it's goals oriented. So we are not talking about general support to CSOs. We are talking about public funding that it's allocated to reach certain health goals in this case. And the evaluation should be oriented towards looking to what extent these goals have been achieved. Independence, free and fair competition, transparency, accountability are all principles that have to be considered, discussed, and keep in mind when we are looking at how a country is planning to or is already funding civil society to provide certain services. So what I mean is by independence is how the civil society is going to keep independent despite being funded by government to provide services. What are the measures that are going to be put in place to protect this independence? When we talk about transparency, is how the government is going to publish the criteria for selection of those providers, as well as what are the requirements for the CSOs to be transparent on the way, on the targets that they are achieving, on the way that they are managing their resources. Next slide. And finally, I would like to bring some of the lessons learned from the early efforts of the support that Global Fund and others have been provided in this area. So one is start early. We know from a fact that some countries are taking a lot of time to be able to put in place these mechanisms. So do not wait for the transition grant to be able to start these discussions, but start early, start with some effort, a small commitment from the government many years before transition. So this can be built gradually. And this relates to walk if you cannot run. So if you are able to negotiate within, for example, the grant-making discussions, 5% of the co-financing commitments go into this public financing of CSOs, this is already a start, and you can build from that. Windows of opportunity. Use every window of opportunity that you can. And I think the COVID example, the COVID context is an example of how to profit these windows of opportunity. Some governments have relied on CSOs to be able to bring services where they have not been able to do it because the facilities were closed or other element or other circumstances. So how can we use this to build a discussion in the country on how to maintain this collaboration in the future and expand it to other services? Capacity building, very important in both sides. CSOs, how to work with the government under this type of agreement. From the government side, how to be able to guide, to set up the right mechanisms to keep the CSOs accountable, to adjust the strategy as needed to meet the goals that are that the country has defined. Optimal use of resources available. So what we are encouraging is the use of guidance, templates, training tools from other countries. There is, of course, the need to tailor many of the those resources to country-specific needs, but many of the resources are very, very similar. So do not start from scratch. Use what is available to inform and to input into this development and in these efforts. Then routine collection of data. We often see that CSOs are doing a great job, but they are not collecting the data to show the work that they are doing. So it's very important that this data is collected and is put together to be able to explain others the importance of that work and the added value that is bringing, and invest in that communication based on robust data that you have. Join efforts with and learn from others. So what we've seen in many countries is that while in the HIV world, there has no been funding from the government to CSOs to deliver services. There has been funding in terms from the government to CSOs to work on disabilities, for example. So learn how they have done it, what is the type of agreement that they have, and try to bring that to the HIV or TB arena. Diversification of funding sources, of course, there shouldn't be 100% the concentration of government funding either, and accountability. Government and civil society need to be both accountable on the resources and the results that have been agreed to and achieved. That's all from my side. And just to let you know that if you need more information on this topic, there is plenty that many of the country teams as sustainability transition specialists can provide to you. Thank you.
Thank you so much, Carmen, for this presentation. Now, I apologize for the background noise, but this is part of the new normal. Now we'll have a short space for questions and comments. To you the favor of being short in your intervention so that we can have the participation of other people, and please open the microphone. And if one is of one on YouTube have a question, please write in the text in the chat box for the panelists. Anyone? The questions, but I have two for you. Taking into account the impact of COVID is having in the region, will there be policy adjustment, especially in the implementation times of the beginning of the transition in the LAT countries?
Matt, do you want to go ahead and take a stab at that?
Sorry, I don't listen to you.
Sorry, hold on. Matt is best placed to answer this question.
Paul, happy to take a stab at it. Diego, I missed the very first part of the question because you were in and out on my computer. Could you repeat it, and then I'm happy to address it?
Yes, of course. Taking into account the impact of COVID is having in the region in Latin America, will there be policy adjustment, especially in the implementation times of the beginning of the transition in the LAT countries?
So it's a good question, and thanks. I'm happy to address it, and then Paul or other colleagues, if you want to weigh in, happy to have you. So I think the first thing we have to remember, and I think Julia made this point really well in her introduction, is that while transition is a huge focus in the LAC region and a big focus for the Global Fund overall, there's not actually that many countries who are transitioning, or disease components that are transitioning away from Global Fund financing. And I say that because it really gives us an opportunity to think about how we use the existing financing to strengthen the work we're doing, much of which is relevant given the challenges that COVID is going to present. So I think that's really key to make sure we're clear on. I think in terms of how COVID affects our work, I mean, it's clear that COVID presents lots of challenges. But I also think that we need to think about whether or not COVID changes anything fundamentally about the STC agenda, so to speak, or the things that are really important to strengthening sustainability. And I think it's one perspective would be that the things that we are emphasizing in this work, whether it's advancing planning earlier, whether it's making sure we work closely with all stakeholders to realize co-financing commitments, whether it's making more strategic investments in health systems, strengthening efficiency, these are things that are actually probably reinforced in terms of importance during COVID. And so really reinforcing and redoubling our efforts to try to address those challenges is probably the best way to navigate this. And as I think Julia said, the policy gives us a lot of flexibility to be able to adjust. In terms of timelines, I think it's too hard to know, Diego. And I think as Julia said, we're at the very beginning stages of this. And luckily, we still have most of the countries in the region who have Global Fund financing, and I think we need to really leverage that financing and use it as much as we can to address these challenges. Paul, do you want to add anything to that?
No, I just reiterating a bit what Matt's saying. I think that As we discussed when we had this webinar in Spanish with our colleagues in the region, I think it's really an opportunity to push even more for making sure that the investments in the diseases happen, as there's increased attention in the health sector, and making sure that the diseases do not get left behind. And as challenging sometimes as it may seem, or daunting to meet different co-financing requirements and commitments that have been made, I think making sure that civil society stakeholders, partners, and all the people that we engage with in country continue to push their governments to meet those commitments. It's really will be critical for the long term of the responses to the three diseases.
And Paul, maybe just to add to that, I by no means want to underestimate the challenges that COVID presents. They are significant, and I think we all recognize that. But I think to Paul's point, we want to make sure that the way we address STC in the context of COVID, and the way we utilize flexibilities, the way that we think about timelines, doesn't actually undermine what we ultimately want to achieve. I think Paul's point is a good one. The Global Fund has lots of flexibilities, and we often use them when it comes to co-financing. But at the end of the day, we want countries to pay and support financially the types of things that the Global Fund has often supported, particularly services for key and vulnerable populations. And we really need to work together, particularly in a COVID context, to make sure that we're advocating for those things to take place. And I think across lots of the pieces of the agenda that links to STC, that's the same thing. We want to see advanced planning. We want to see more efficiency. And so while I think the Global Fund recognizes that flexibilities exist and we should use them strategically, we want to make sure that those flexibilities also don't undermine our overall efforts. So I think that's how I'd respond, Diego.
Thank you, Matthew. Paul. Manin, have a question? Please open the microphone.
Yeah, hi, everybody. Nice to be here, and nice to see some faces back. Just two of them are with their faces on the screen now. I had a question which is kind of a political question. You may know that some of the countries are now negotiating new plans with the International Monetary Fund. How is the Global Fund, maybe at a more global level, engaging also in this? How can we assure that those packages are not going to affect further the adjustment of the health services?
So thanks, Marina. I think that the Global Fund in general hasn't been super engaged in negotiations of packages and different and large macroeconomic measures with different governments. I think that, again, where the emphasis is and where we're working with country stakeholders is to put the focus on making sure that the commitments that have been made are met, and that as many countries in our region and throughout the Global Fund portfolio are putting together new co-financing commitments for the next 3 years, that they are also strong and that those are met. Several countries use financing that they've received through concessionary loans for health or through other multilateral development banks as part of their co-financing. And so this is another area as well where we've been working with countries, depending on the context, to make sure that those commitments remain, and that they try to, if they need to find fiscal space to strengthen the responses and to make up for maybe domestic resources that are not currently available, that they try to use those mechanisms as well. But in terms of the directly on the IMF, I would say it's limited, though. I mean, all of this is, we'll see how the countries all become, if there's changes in classifications of their income levels, which would then, of course, affect their eligibility for Global Fund support.
Thank you, Paul and Manin, for the question. Someone else have a question, please? If no, I want to say another. The community should play a prominent role in monitoring the implementation of the policy, existing examples in the region of good practices. We can ask.
Sorry, can you repeat that, Diego?
Of course. The community should play a prominent role in the monitoring the implementation of the policy, existing examples in the region of good practices?
So I think that I mean the STC policy is something that's generally monitored at the global level by the governance mechanisms that the Global Fund has, that communities and are part of. I think that where there really needs to be focus, and in the LAC region, there's some really good examples of this, is really trying to say, okay, this is we've gotten from point A to let's say P or Q in this process of preparing countries for dialogues on sustainability and transition, making sure that there are changes in what's being funded, for example, than what was happening before. In the LAC region, a lot of countries were mainly eligible for HIV funding because of the key populations prevalence rates. There was previously a focus of application requirement that basically 100% of the programming had to go for key populations, and then which left not a lot of space for improving and strengthening key systems that we mentioned here, like health product management, health management information systems, that those were being left behind. And with the changes that have happened over the past several years, and now into the second cycle of the SDC policy, we're seeing opportunities to strengthen those systems, make investments in those systems, but that also means that sometimes there needs to be changes in some strategies in countries and what those investments are going towards. And so I think this is something where it's really important for civil society actors to understand things that might be not necessarily their areas of expertise, which is the idea of these annexes in the guidance note, to really understand in the transition context or in sustainability planning what should be considered for in the monitoring and evaluation systems, or in their health information systems, or the health product management. And so that's the objective of these annexes, so that then they can bring these questions up to the CCM if that's where they're engaging, or in dialogues that they have regionally as well, to make sure that they're making the response as strong as possible for an eventual reduction of global fund support or transition.
Well, this is Veronica, just to adapt. I think it might be very important to identify what is the role we all play in sustainability and transition in each one of our countries. So I strongly believe that civil society has a very important role in advocacy and in demanding accountability from the government and from institutions that are responsible for financing the programs. And this might be really interesting in the context of COVID, because this might be played in our favor at some level if we consider that health is again in the international and national agenda. Some of the countries are just realizing how important financing the health system is, how important universal health coverage might be for responding for such menaces and for such situations. And if we don't take advantage of this specific moment, we might lose a window of opportunity. So right now, we might actually advocate for countries to get interested, and for governments and decision makers to take interest in transition and sustainability. And how can this be achieved? If we don't push for these elements to be placed on the agenda, on the priorities, on the discussion, then we will not see the changes or the progress that we are expecting. So I think the guidance is calling us for this kind of actions, and I think that the COVID context is actually an opportunity for us. And even though we know that this is putting us in a very complicated situation, it's also pushing us to think in a more innovative way. So countries are actually seeing how important it was to invest in laboratory capacity, and some of these examples might actually be implemented for a good for having better results in the response for HIV, TB, and malaria. So I really think that we should be discussing this with decision makers. And related to the question that was mentioned about the multilateral agreements. Well, then again, I think that the role of civil society in participating in those sorts of agreements and putting their voice out on how this might impact the financing for health, it's very important and transcendent, and I would encourage that. Thank you.
Thank you, Paul and Maria Veronica. We have a question from Joan. Joan, hello.
Thank you, Diego. Thank you very much. Thank you, everyone, for very nice presentations. I have 3 short questions. You allow me. One is related to what just Veronica was saying and Carmen presented. It's to what extent we can provide countries with examples on how to balance the engagement of CCO in governance and leadership, and while taking care of conflict of interest, because they want to be eligible for social contracting. We have seen that tension in some countries that that seems to be at this point one of the barriers to progress on social contracting. So good examples from other countries where this has been solved will be good. That's one question. The other question is about to which extent it's more a question relating to impression. I have the impression the guidance node does not pay enough attention to social determinants, and that's related to HIV and TB both. And I think poverty particularly is one of the greatest barriers today for to reach the most vulnerable and populations. So I would like to know if to what extent this should be also part of the discussion with the countries. And finally, third question is about, again, balancing between how to have smooth and well-planned procurement plans while complying with anti-corruption measures in some countries. Those measures seem to be very much important and bureaucratic, but also slowing the process tremendously in the procurement procedure. Thank you.
Carmen, do you want to take the first questions, and then maybe Bhushan can take the last one? And then we'll probably have to close.
Yes, so on the examples on how to manage this duality, this double role. I mean, I always referred to the work that organizations such as Oxfam are playing in different countries, and I know that this requires a level of institutional development and discussion, but this dual role can be played. We brought this specific point to the consultation that we had in Istanbul in December. And of course, this was a key concern by many actors, but also in the consultation, they showed how organizations can play, this dual role and manage to be in this fine line of playing, of keeping their advocacy role while providing services. Organizations in Ukraine, in India, and in other countries show examples of how they've done that. Basically, 2 key messages were given. One is better if you do it jointly. So if you keep work of organizations that are working together and the statements are published jointly. And second, keep your statements based on data and collection of examples. So this is, a call for everyone to say, yes, it's possible, and we have to find a way to make those requests, those complaints, as based on facts as much as possible and with concrete data. Second, on social determinants, yes, you are right, Joanne. I think that there is probably a need for a stronger emphasis on this element in the note. It's included, but probably should be more emphasized, and the COVID context even put its more importance into that. We've been working with UNAIDS in the social protection discussion, and how important it is to ensure that beneficiaries or of those support within Global Fund grants are continue receiving this support through institutional mechanisms of social assistance. So we are working, for example, in Dominican Republic in bringing this change from government, from Global Fund to ProSoli, which is the government program for social assistance. So this is definitely an area of attention and probably it should be further highlighted. Thank you.
Thank you, Carmen. Now, Uchan.
You can hear me?
Yes.
Yes. So I just read the question from Joan and a very important comment on the possible anti-corruption rules in the country, which can be a barrier. So like I said earlier, I think all the national policies, rules, and regulations, including financial and procurement, need to be clearly understood by the disease programs or the programs that are managing the diseases, and options be looked into early on. So like all of us started and Carmen highlighted at the end that the key thing is to start early on with the right stakeholders, be it the national regulatory authorities, which might need to provide regulatory waivers, be it national procurement entities, who could guide on different procurement options. And like we said in the slide as well, that there are now international procurement mechanisms as well, including Global Fund, our WAMBO PPM mechanism, which we publish the prices clearly on the website regularly, which is very transparent. And again, if such mechanisms are considered and compared against, for example, other opportunities of procurement, example in the country, then I think even the anti-corruption entities and officials could be clearly explained that these are the options we have, and this is how we will address any possible anti-corruption or collusion issues that we do see at times in the country. So I think the plan is to start early, look at all the different options in line with the national rules and regulations, and look for flexibilities or options beyond the country's procurement system, if allowed, or to advocate for options to work towards those flexibility as well. So I think the key is to start early and look at all the options available. And nowadays, the options are increasingly more, and Global Fund can assist in providing that option as well. And GDF can provide for TB products, and then work with all the key national stakeholders to explore and discuss and see how everything can be laid on the table and make a fair and transparent procurement process can be planned for future. Thank you.
Thank you so much, Luchan and Carmen. Cesar shared in the chat the links for the webinar in Spanish, for the download the guide in our platform, and download the sustainability planning and transition preparedness. All the links is on the chat now. We are going to the final. I don't know, maybe our guests can share something else.
No, I think we'd just like to thank everybody for joining. As we mentioned earlier, we have done the session in Spanish and now in English, and we hope that not only for the LAC platform, but that this can also be shared with the other platforms to help disseminate more information about this guidance and these tools that are available for stakeholders to use. So thank you very much, Diego and the rest of the team at the LAC platform for organizing this, and to my colleagues for joining us to present and continue during the Q&A. And we wish you all a great day.
Thank you, Paul. Someone else? Okay. Well, thank you very much for the panelists for joining us today with this important issue that not only direct impacts Latin America, but also other regions that benefit from the response to the tree disease by the Global Fund. Thanks also to all the people who joined us today, and we are waiting for you at our next webinar. Don't forget, follow us on our social media and visit our website, plataformalac.org. Thank you so much for everyone, and see you soon. Bye.